Hello and good afternoon, everyone. I hope you are all having a pleasant week. Thank you so much for joining us today for our May coffee chat. The topic for today's coffee chat is mapping partners to create healthier communities. My name is Molly Garrone. I'm a senior communications coordinator for the Choices Project at the Prevention Research Center on Nutrition and Physical Activity at the Harvard T.H. Chan School of Public Health. And as always, it's my pleasure to be facilitating today's discussion. So just a disclaimer, I would like to acknowledge our funders who make this work possible and mention that our Choices work and events are only for research and educational purposes. The intention of today's coffee chat is to provide information, tools, and resources to inform and educate. We are not looking to influence any specific legislation. I also want to note that myself and our guest speaker for today are sharing personal perspectives, and we do not speak on behalf of Harvard. So for today, we will start by hearing a presentation from our speaker, and then we will move into some planned Q&A. Today's coffee chat will feature a discussion of resources available through the Mobilizing for Action through Planning and Partnerships, or MAPP 2.0 framework, including tools to help you think broadly about partners to engage, as well as ways to leverage existing work to address your priorities. Our guest speaker for today previously presented about the MAPP framework during coffee chats in 2023 and 2024, and how it can be used to support community health improvement initiatives. So I'm thrilled to be welcoming back Anna Clayton. Anna is a senior program analyst at the National Association of County and City Health Officials, or NACCHO, on the Public Health Infrastructure and Systems team. Anna has a Master's of Public Health from the University of Maryland, College Park, and has been with NACCHO for 5 years. She leads their Mobilizing for Action through Planning and Partnerships, or MAPP portfolio for community health improvement. The MAPP team provides guidance, trainings, and resources to support local health departments in their community health improvement work. So again, welcome, Anna. We are so excited to have you back with us today. And I'm going to give you the floor to get us started with a poll question.
Great. Thanks so much, Molly. So yes, I'm really happy to be here with you all today. And we did want to start with a poll to learn a little bit more about your familiarity with MAPP and whether you have used the framework before, whether you have just heard of MAPP but haven't used it before, or if you're brand new to MAPP, which is great. So go ahead and respond to that poll. I know we have a lot of local health departments on the call today, which is great. So maybe you're familiar with MAPP from your work or your work of your colleagues, or you've been involved tangentially. And I know that we have many from other kinds of organizations too, and MAPP really engages the whole community. So you may have had touch points with MAPP as well. Great. So all right, looks like about half of the group has heard about MAPP but has not used it. Awesome. So maybe there will be some tools today that you might find useful. You can definitely pull tools from the MAPP process without doing the full-blown MAPP process and use those in your work. I'm really excited to see that nearly a third of you, this is your first time hearing about MAPP. We're talking about partnerships today, which is really like the bread and butter of the MAPP process. So this is a great way to be introduced to the process. And then a quarter of you have used MAPP before. So definitely would love to hear some of your perspectives as well on what that's been like for you to use the process. Next slide, please. All right, so mapping partners to create healthier communities. Today, I'll be sharing about tools within MAPP to help you build more diverse and more strategic partnerships. So you can see partnerships is right in the name of MAPP. So it's really about engaging the community broadly. And if you're finding in your work that there's a need to engage more partners or engage the community more broadly, or you're wanting to expand or deepen your partnerships, then I'm hoping some of these tools that I'll share from the process that you can pull and use to do that. Next slide, please. So Molly already introduced me, but if you're not familiar with NACCHO, NACCHO is the membership organization for our nation's over 3,000, nearly 3,200 local health departments. We provide training, funding, resources, capacity building, and technical assistance to local health departments to help them improve their work and their work with their community partners. Next slide, please. So, my hope for you by the end of this session is that you will be able to define what the MAPP 2.0 framework is for community health improvement, and that you can describe how to broaden your network of partners across the local public health system using MAPP 2.0 tools, and that you'll be able to explain how to use a community partner profile to align partners to shared priorities. Next slide, please. So, introduction to MAPP for some of you, maybe a refresher, or maybe you're new to MAPP 2.0, but MAPP is mobilizing for action through planning and partnerships, and it's NACCHO's framework for community health improvement. So it was originally developed in 2001, and then from 2018 to 2023, NACCHO led a MAPP evolution process to update the framework to MAPP 2.0 based on evaluation feedback. So we really streamlined the process, engaged many different parties who are users of MAPP, so other national associations serving health centers and hospitals. We engaged end users, so many people from local health departments and state health departments to update the framework to help make it more effective at achieving its goal of improving population health. So MAPP and community health improvement, if you're not familiar with community health improvement or CHI overall, it engages the entire community and the local public health system, which includes agencies, organizations, and community members across sectors who contribute to health. These groups work together to conduct a community health assessment and develop a community health improvement plan, which is a strategic plan for how everyone can work together to address health issues. So the MAPP 2.0 process involves these three big phases in order to identify and address those community needs. So phase one is called Build the Community Health Improvement Foundation. This is when you're really gearing up for the community health improvement process. But the steps are really important because this is where you're building those connections across the community. So we're preparing for community health improvement and that assessment by building partnerships, expanding out beyond just what we might consider our traditional public health partners to really engage all sectors who touch health in some way so that you can include their perspectives in the process on what health issues are, what contributes to those, and that they're also engaged later on in identifying and implementing solutions over time to address those priorities. So phase one, broadly engaging partners in the community. You're setting a vision for what does our healthy community look like in the next 10 to 20 years, and how can we use a process like MAPP to get there. In phase two, this is called Tell the Community Story because this is where the community health assessment is conducted. And you can use three assessment tools within MAPP 2.0. And it's called Tell the Community Story because each assessment really looks at community health from a different perspective. So the partner assessment is really an assessment of the local public health system itself. How well are the partners working together to improve health in the community? Where are there gaps in services or populations served? The community status assessment is going to uncover those health priorities and what might be contributing to them. And the context assessment, rather than only being, you can use a survey, but rather than only being a survey as the qualitative tool, it's really a mixed methods, or it's a qualitative assessment that uses many different methods to gather community perspectives directly. So the idea in the context assessment is to learn from community members in particular and directly what is contributing to your health from the built environment, from forces of change and just things that are happening in our community nationally and globally, and what are the community strengths and assets, and how can those contribute to health as well. So phase two is that big comprehensive assessment. And in phase three, you prioritize what issues came up in that assessment and create a plan to address them, which is that community health improvement plan. And that's going to be implemented with your partners. So the tools that I'll share today that have to do with building partnerships, they come up both in phase one when you're identifying partners, because you want to engage them really early in any process like this, not only when you're ready to take action. And it's a tool the second tool is a tool from phase 3. Once you've identified, here's a specific priority we want to work on, we have a small group of partners who are related to this issue who want to contribute to working on this. Now, how can we leverage work that's already being done to address this priority together? So a couple different lenses on partnerships and some tools there that I'll share. Next slide, please. So backing up a bit, I've been talking about partnerships a lot, and there are many benefits to partnering with other organizations in the community to achieve those community-wide goals that you share. So when we're trying to address factors that influence health, we know that many different factors across the community influence health. No one organization or no one sector can be totally responsible for building healthy communities and giving people the resources that they need to be healthy. So we're really trying to engage the community broadly, including community members, many different sectors, government agencies, community-based organizations, and I'll talk a little bit more about that in a couple slides. So local organizations bring essential resources to the process, including just skills and expertise that they might have on a specific subject matter. They might have data analysis skills that they could bring to your assessment process. They might have funding, so funding for a specific project where they can hire on additional help for that project, or they have funding to contribute to the community, to engage community members in the process. And just staff time is a resource that we need to get this work done. But more importantly, perhaps, partnerships, as you expand your partnerships into the community, you're building more of that connection with different groups within the community. Because community-based organizations are often rooted within the neighborhoods and communities that they serve. So that's a way to really expand your reach there and engage community members who are really involved with the programs there, or even with leading, carrying out, or participating in the work of that organization. So that is all to say that involving a wide variety of local and community-based partners would ensure that you're representing the needs of the community more sufficiently. And maybe you all just want to add in the chat anything that stands out to you or things that you would add in terms of benefits of engaging partners in your work as you have done now. So what are some benefits that you would add as far as benefits of working with partners? We'd love to see a couple in the chat. All right, and I'll move us along while you're adding those, but please do, because this is just a short list. So I'll move on to our first resource. So this first resource that I will share can be used to help you broaden the diversity of organizations who you might work with to address those community-wide priorities. So this is the analysis to identify partners that's in phase 1 of MAPP. The goal is to help you identify diverse potential partners across the local public health system and use a really clear understanding of their distinct characteristics to determine how you might want to engage them. So we often work with the same partners all the time. And if you want to expand your network of partners, you need to make a really intentional effort to look broadly past those whom you've always worked with, or just those traditional partners who we've all engaged for years, like the, again, hospital system, health departments at different levels, health centers. Those are important partners, but this tool is going to help you look beyond that and more strategically. And next slide, please. So this analysis has 4 major steps. It starts with a really broad brainstorm to think about who is in your local public health system. Then you gather information about the work that each of those organizations is doing to better understand how they could impact your community health improvement process if you're doing MAPP, or just how they could impact this project that you're working on and how they relate to the priority area that you're looking to address. And you would actually take down this information in a table that's offered for this analysis within the MAPP tools. So, gathering that information might involve consulting with some key individuals or kind of like key informant interviews, where you could even engage a organization whom you've never worked with before, but you know that they have really strong connections with the community, and you know that you share some vision for a healthier community in the future, or maybe you both kind of tangentially touch the same priority areas. There's guidance within this tool to have an interview, a kind of an informal one-on-one with someone like that to learn more about their organization, their take on what community priorities are, what they think is needed to address them. So that's a tool that you can really use to help start building some new relationships. But also through that interview, you're gathering more information about that partner or organization. And then you conduct some analyses, and we use analyses lightly. They're very simple and straightforward, but it's basically just some analyses to pull the information you've gathered together based on what you've learned and make some actionable decisions about how do we want to engage this organization in the work that we're doing. So how much do you want to prioritize working with them over maybe putting more energy into another potential partner? And this here on the right is our beloved jelly bean diagram for obvious reasons. And we use this jelly bean diagram as a way to depict the wide array of organizations that make up your local public health system. We have the community in the middle because this work is all about serving the community. So we don't have the health department in the middle or any one organization. All the common thread between all these organizations is that they're serving the community. But you can see it involves faith-based organizations, civic groups, elected officials, corrections, employers, the public health agency is in there, those who serve mental health. So really anyone who touches the health of the community. So as you do that brainstorm, you would start with some broad questions like who has an impact on the same communities that we work with, where we want to see an impact? Who wants the same outcomes that we want to see? Who have we worked with in the past? And who are they working with? And who has expressed interest in working with us in the past? All right, next slide, please. And thank you for that note in the chat, Danielle. I see that MAPP 2.0 has allowed she and her colleagues to highlight gaps within sectors so that they can then direct their efforts where needed in order to ensure the full local public health system is represented. That's awesome. Thank you so much for sharing that example. And please continue to share your examples in the chat. All right, so then using this analysis, you gather information about each of those groups. And that information that you gather in that table I was talking about might be things like, what is this organization's knowledge of this program that we're working on, or the subject matter expertise that they have related to this program? What is their knowledge of community needs generally? Even if they don't work on the same health priority that we do, how much are they really in tune, like day to day, with what community needs are? Or do they have particular access to really helpful data about community needs? Interest is looking at what is their investment in the same priority that you're working on, or in the community's health more broadly. Alliances, that's going to be something that helps you keep expanding that network that you're building this visual of. So we've identified this partner, who are they closely working with? And then you might fill out this information for those organizations. So you can tell that this really isn't about gathering information on just a small group of those who you know you want to engage, but you're just trying to kind of create a map of who all is out there. And then you can use this information to determine where some new opportunities might be to engage new partners. And then things like resources and skills. So thinking tangibly, like what could they contribute to the work that we're doing? Even if we haven't talked to them about it, what resources do we know that they might have? And influence. What is their ability to impact the program or initiative? So do they have some kind of really important decision-making power over resources that matter for the work that we're trying to do? Or are they part of the local legislature and they really have a lot of influence to determine how you can improve community health? All right, next slide, please. So, as I mentioned, you take all this information together to draw some conclusions about how you might want to engage each of these different organizations or not. So, there's some prioritization happening here. And these are the four kind of light analyses that are included. And some of these you might be familiar with from other analyses of potential partners. So first is primary, secondary, and key. This is where you're taking your big list that you've identified and kind of prioritizing. Primary are those who are going to be directly impacted by your program or priority area. Secondary are those who are kind of tangentially impacted. Maybe it's an organization that serves the primary communities that are going to be impacted. And key are those who have really important resources that can really help move your work forward. Talked about alliances. So what kind of connections do they bring? How can those alliances help promote more collective action and expand your network of partners working on this priority together? In knowledge, you're bringing together, looking at one organization, what is their knowledge of community needs and what is their knowledge of this specific subject matter that we're working on, and trying to identify those who really bring both to the table. And last is influence and interest. So our 2024 MAPP related coffee chat talked about this specific analysis and how you can look at the intersection of what amount of power does this organization have to impact our priority, and are they aligned with us? Do they want to see the same outcomes we do? As opposed to, they have a lot of influence on this specific priority area and they could really help determine if we are successful, but they do not want the same outcomes that we do. So it's possible that they could really get in the way. That analysis is going to help you prioritize those who both can make a big difference and want to work with you and want the same things you do, and help you kind of avoid those who might get in the way, and also help you deprioritize engaging really actively with partners who don't have a particular interest in the priority you're working on and don't have any particular resources or influence to name. So there's kind of like not much that you're going to get out of that partnership on this priority area anyway. So that's a really helpful prioritization tool. And we'll talk about that a little bit more later this afternoon. All right. So that is the first resource, is that step-by-step process to conduct that analysis and really strategically expand the types of partners who you might want to work with on a specific issue or on community health improvement. And on the next slide, we can move to our second resource. So, excuse me, the second resource is the community partner profile. So this is a resource that comes up in phase 3 of MAPP. That's after you've done the assessment, after you've narrowed down what the priority issues are that you want to address. So you could use this in a program that you might be leading today, that you have specific grant funding for, or a project that you've continued over many years, but maybe you're looking to engage partners on it in a bigger way. So this really comes into play when you know the priority that you want to work on, and you know even what kinds of activities you might want to be doing for that. Oftentimes, we have a tendency to want to create new and exciting programs when we're bringing multiple groups together. I personally am always up for a brainstorm. I love to vision where, something we're working on, like a brand new project that we could create out of it, how you can bring expertise from two different parties together and create something beautiful and new. But we don't always have the resources to do that. So this tool is going to help you identify what work is each party already doing that could be leveraged to address our priorities, so that we're building from what's already working and what resources we already have, rather than only setting out on a brand new project. Next slide, please. So the way that this profile works, it's really just a worksheet that you would give to each partner. Say you have 4 partners who are working together on a priority issue, and I'll give an example in a moment. Each of them would fill out this worksheet and share about the communities that they serve through their organization, the mission statement and values that guide the work of their organization, And then they would list out any current programs that they have going that are related to the shared priority you're working on together. And we get really specific about it. What are the goals and objectives of that program? What are the outcome metrics that you're tracking and the process metrics that you're tracking? What resources might you have available to contribute to this shared priority? And the process and outcome metrics are really helpful here because that shows you what data is already being collected from some of our partners that we might be able to tap into if it's related to our priority. And we can use the data they're collecting from the community to understand if our project on this priority is moving in the right direction. So it's not only about finding alignment with resources that other organizations have, but what data are they already collecting so that we don't have to spin up entirely new data collection systems, but again, can work from what they already have to understand community needs. So I will briefly, or on the next slide, I'll kick off an example of this, and then I can share my screen to show one briefly. But imagine that you have a collaborative of 4 partner organizations working together to address food insecurity in the county. So it might include a school wellness collaborative, the health department's Department on Chronic Disease, your network of food pantries, and a community-based organization that serves families. So you could use this profile to help identify opportunities for each of them to leverage work they're already doing and find alignment to serve this shared priority on addressing food insecurity. So I can share my screen now to show an example of a community partner profile from a fictional school wellness collaborative and consider how it may introduce opportunities to leverage existing work and data. So at the top of the profile, and we can send this out afterwards, you can take a closer look, so I won't read through all of it, but you're listing the priority issue that we're working on, so food insecurity among children and families in Sunshine County, and these are the mission, vision, and values that guide our shared work together. Now, to be filled out by the community partner, this Sunshine County School Wellness Collaborative, Jessica has filled this out. Don't go to this website, it is fictional, I hope. So Jessica here has described who their organization serves, K-12 students and families, trying to help them access free or reduced price meals. So that is obviously related to this priority issue. She shares about that their organization's mission statement is to create a healthy school environment where students can thrive. And since the CHIP priority issue, the shared issue you're working on is addressing food insecurity, she's listed here 3 programs that their wellness collaborative works on to address food insecurity. And just going with one example, if she listed that their weekend backpack program provides food for students to take home over the weekend. The goals are about reducing child hunger and food insecurity, particularly among low-income students. And they're tracking students who participate in the program and gathering data from school attendance and nurse visit data, which may be useful as part of your shared priority looking at food insecurity across the community. And then process metrics. So we use process metrics to track if our program is being implemented as intended. They're looking at the number of backpacks they're distributing and partner participation in food drives. So you can see a couple opportunities here where either elements of the program itself or what they're measuring as part of it could be brought into your shared work to address food insecurity. There's a checklist of many different resources that the organization might be able to contribute, and you could tailor this or make your own version that's specific to the work you're looking to do. And then there's kind of a brainstorm area for that partner to add, what do you think are some goals and strategies that we should consider to address this priority? So they would list out strategies or goals that they think are of importance. And then you have all of these worksheets that you can bring together as a group and see where's their alignment, where are the opportunities. So there is much more to explore in MAPP. This was just a look at 2 tools to help you expand and more strategically engage your partners. But you can visit nacho.org/MAPP to access the MAPP handbook, the assessment tools, additional supplemental tools, and downloadable templates. all are available for free to download. You might need a free MyNacho account online, but that is available. And we also have our MAPP Network virtual community where you can access pre-recorded trainings of the major tools and processes within MAPP. There's a discussion board to connect with other communities implementing MAPP. You can post questions, respond to others' questions, and there's recommended webinars and tools to support your work as well. But thank you so much for the opportunity to share these resources today, and I'm looking forward to our discussion now.
Awesome. Thank you so much, Anna, for the deep dive into the importance of partnerships in public health and these awesome resources. Really appreciate it, especially walking us through that community partner profile example. That was really great. I love that resource, and I am excited to ask you some more questions about that in a few minutes. I just want to flag there was one question in the chat from Laura asking if you could clarify how the MAPP core group is developed.
Yes, thank you, Lara, for that question. So just to give some context around that too, within MAPP, you could do this anyway in your community, but kind of if you're looking for a recommended structure, the core group is the 2 to 3 maybe individuals who are really doing the day-to-day work of carrying the MAPP process forward. So, there's administrative work that needs to happen and planning that needs to happen. Whereas your steering committee is like the broader collaborative of partners who might be meeting quarterly or monthly. And the core group is kind of preparing for those steering committee engagements to use those partners' time well. So the core group is usually kind of spun up from the organization that might be leading or convening MAPP, or the 2 organizations or something. So it might be one person from the health department, like a community health improvement coordinator, and then maybe someone who's leading the community health needs assessment at the hospital. But you're really looking for who can be the couple people that have time dedicated to be tracking all the details throughout the course of the full MAPP process. And in the MAPP handbook, in one of those first chapters, there's some tips about developing your leadership committees that you can reference as well.
Awesome. Thanks, Anna. Hopefully that answers your question, Laura. Great. Terrific. So keep the questions coming. This is great. I know we do have a couple more poll questions, though, that we really want to just check in with the audience on. So I'm going to launch a second poll here. So we would love to hear from you on which of the following best describes your work with partner organizations. So are you partnering kind of infrequently or sort of just starting to look into partnerships? Maybe you're already working with a really established set of partners, or perhaps you're looking to really expand your network. So take a moment or two to think about that, and then we'll see where folks are at. All right, I'm going to share our results here. So that is awesome. So it looks like folks are already working with partners or working to expand their network. So any comments, Anna?
Yeah, that's great. Love to see that you all are already doing this work of thinking about how the broader community can contribute to your work. And you can still, if you're interested, think about some of those partner expansion tools. Those can be helpful to go back to, even if you're already settled into a kind of collaborative among many community partners, can look at that as an opportunity to say, there's always that opportunity to say who might be missing. But really love to see that you all have these established partnerships or are thinking about expanding further.
Terrific. Thank you. And thanks, folks, for responding to that. And sort of follow up to that, Anna, I'm wondering if resources are kind of limited for folks, where would you recommend focusing efforts on first when it comes to partnerships?
Yeah, definitely. And I know that, or we know that when you're already doing the work, thinking about, so partnerships are relationships and it takes time to build those. So if you feel that you have limited time to be expanding and it feels like a lot, I think it's always okay to start with low-hanging fruit, easy wins. Who are those other organizations in our community that are doing work very similar to us, who maybe we just haven't connected yet? And again, those who want the same outcomes that you do, or those who have some helpful resources. And I think the other thing I'd note is that partnerships can really start at just the level of networking together, just becoming more aware of one another's work. The interview process that I talked about in that first analysis is kind of similar to this idea of a one-on-one, which I learned from a colleague in Lake County, Illinois, Anna Yankelev. If any of you are familiar, she does a lot of community health improvement work and has presented on other national opportunities. But this idea of a one-on-one is that you're just looking to connect with that other person from another organization without any agenda for, so how are we going to work together, or what are we each going to dedicate, but just building that relationship and trying to stay in touch on what you're doing so that you're kind of ready when opportunities come up in the future to start working together and you've already built that foundation of a relationship.
Excellent. Great recommendations. Thank you, Anna. All right, so I have one last poll here that I'm going to launch for the group. So take a moment to think about this one. Where would you say most of your partnerships fall on the partnership spectrum? So maybe networking, just sort of aware of others' work, coordination, ensuring your and their programs sort of complement each other, maybe cooperation, contributing to each other's projects, or actually collaboration and creating new projects together. So take a moment to think about that, and we'll see where everyone's at.
And as you all are responding to that, I'll just point out, even if I didn't have it in here, but if you Google partnership spectrum, there's different versions of this. And it's just kind of a helpful way to think about and kind of assess where you are with a specific partner and then look at what it might look like to move up that spectrum. But there's a number of resources and kind of visuals that you can use with this. Awesome. Okay, great. So many of you would say that you're at that stage where you're aware of one another's work, and then kind of gets understandably sort of less as we move toward full collaboration. I understand too that much of the work in public health, or maybe most of the work, is designated by a specific funding stream. So you might not necessarily have the control to decide who we're going to bring in on this project. But where you do, just having that foundation of that networking and being aware of one another's work, there might be opportunities there to say, we're aware of one another, what one another is doing. Maybe we want to set up a monthly or quarterly Zoom call for 30 minutes just to talk about what community needs we're seeing and where they're overlapping. And I find that coordination level interesting because I think we might assume that we have to go from networking, like we know what each other's doing, to now we're working together, we're part of a formal collaborative. But there's kind of this middle step where you can just be aware of what one another is doing. And for example, maybe we do host our community events on the same day in the same location so that we can more broadly reach the community, get more interest. Or just as a simple example, instead of that, let me not host our community event on the same day as yours so that we don't get in the way of what you're working on, because we all know that we're trying to work toward the same thing. So again, this partnership spectrum can be kind of interesting to look at, to think what some of those smaller midpoints are in building toward collaboration.
Great. Thank you, Anna. Great tips and advice there. That's great. I'm curious what kind of data or information you think would be helpful in engaging in conversations with partners around analyzing power.
Yeah, thank you. So that was a piece of that first analysis that I touched on called like influence and interest. And you can find some really interesting resources on this, including through MAPP, but also through Human Impact Partners or Health in Partnership, I think they are now, has some really great resources on this. But when you're thinking about doing that analysis, which again is, what power does this organization have to influence our priority or agency or individual? And are they aligned with us? And do they want the same things that we do? When you start that, just start by backing up and thinking about how power is really contextual. So not one organization or person or agency has power in every room that they walk into, in every project that they're working on. So start by first thinking, what is the kind of power and influence that we need to reach our goals on this priority area. So get really specific about that. And then you can really more easily identify, does this entity have it or do they not? And then also, think about spending just as much time on thinking about how you can engage those who maybe don't have a lot of power to influence your priority, but they are going to be really affected by it. So community groups, community members who are going to be influenced by your priority area that you're working on, how can you engage them to help build their power to address that priority with you? But I think starting by getting really concrete of what does power mean in this context is helpful for that brainstorm.
Awesome. That's great. So I mentioned before, I love the community partner profile resource and the example that you walked us through. And I do have questions, follow-up questions for you about that I think folks would love to hear. So I'm curious, how have you seen health departments successfully use that resource to align their efforts, but also avoid kind of duplication of their work? Any examples or any insight to share on that?
Yeah, definitely. I think so. It's come up a lot when we've done trainings, when we've showed this process and had people practice using this tool. And I think one of the insights that comes out of it is that health departments hadn't necessarily considered always some organizations that could really contribute to their priority in a meaningful way. So the partner profile really helps you identify, like, oh, this partner organization who is involved, but they have more resources to contribute than we thought they did, or they're actually already doing a lot of work that's related to this priority issue. And if we were to just tweak it a little bit, then, or pick up pieces of it that are already working, then we could really address the shared priority more effectively together. So I think the lesson learned from that is that taking the time to really analyze what work is already happening among partners rather than assuming you need to start with something new has been kind of a learning from organizations using that tool.
Excellent. Thanks, Anna. So another question on that resource I have for you. So there's that section in the resource with the table where the user will sort of break down the chip priority issue, and there's a couple columns for outcome and process metrics. And I'm curious how could health departments sort of use those metrics, the process and outcome metrics collected to inform kind of joint program planning or decision making?
Yeah, definitely. So, would just highlight that that could be an opportunity to see what data is already being collected among these organizations we're working with. And we don't have to start up a new data collection process, but we can pull from the data they're already collecting. And would just emphasize that getting really concrete about those process and outcome metrics. I know that this is common across public health, but just emphasizing really critical to effective program implementation and quality improvement, because with your process metrics, you're able to track, are we implementing this program as we intended? So are we engaging the amount of clients that we thought we would? Are we distributing the amount of resources that we intended to? And that way you can pivot and switch something up if it's not working, rather than only waiting until you get to the outcome metrics where you see, are we having the ultimate kind of broader impact that we were looking to have? Is this creating the change in the community that we were hoping it would? So you can make those kind of more midpoint changes to improve the effectiveness of your program.
Awesome. Thanks for that additional information. That's great. Um, so folks, keep questions coming in the chat. I do have a question here. Are there any working groups that have formed around using MAPP via NACHO or otherwise that you're aware of?
Yes. So first, I would point to that MAP Network virtual community. People post their questions on there all the time. Things from what kind of metrics have you used to track this specific kind of activity? What data sources are you using? How are you working around this challenge? And that's really, peer-to-peer networking of people sharing challenges and solutions that have worked for them. But also love to note that out of that, kind of this separate small group started up for about 6 months or a year, where it was like 10 organizations from, or 10 health departments from across the US, who got together quarterly on Zoom just to talk about their community health improvement work. And I loved that because it really showed like that opportunity is there just to connect with peers and say, we don't have a really strict agenda for this, but we're just trying to find time to connect. So that opportunity is definitely there to bring those up on your own if you're interested. And we have a MAPP learning community, which is quarterly sessions where we cover some topic or tool related to MAPP. You have breakout sessions with your peers to learn from how they're implementing that work, and then time for questions with NACHO staff and guest speakers who we bring in as well. And that's on our website too.
That's great. Thank you, Anna. Yeah, I mean, there's certainly interest in this audience we have assembled here today. Of course, people were already well familiar with MAPP or already using it. So I know that certainly expands beyond to many people who are interested. So it's great to hear of people kind of connecting on this, but also about the networks that you all actually offer through NACHO. So I think Angie put a link in the chat. Folks can access all of the MAPP resources, but specifically the networks that Anna was talking about through that link. So please make sure to check that out. So I have time for just one more question, and I think this would be a great one to sort of lead us out here, Anna. If there was kind of one like point or message or takeaway or something that you want everybody to leave this coffee chat with related to MAPP or related to the topic, otherwise, what would that be?
Sure. I love that. So I would say if we step back from what are just like day-to-day requirements of our work, of our jobs and our work is, backing up to remember that if we really want to have an impact on community-wide priorities, it's going to take many people to be invested in that and to work on it together. So even if you don't have an exact plan for how to partner with someone else, just start building those relationships so that you're ready to jump on new opportunities together and kind of build that camaraderie and collaboration around, we're all working toward the same thing. So how can we support each other in that work?
Wonderful. I think that's a great message, and really appreciate you highlighting that, and very much in the spirit of MAPP and its tools and resources and its great mission. So fantastic. So I think we have just one final slide, and we're just going to share a couple concluding notes here. So as always, please feel free to reach out to us at any time if you have suggestions for future coffee chats or questions or anything that you want to ask or share about the community of practice. We invite you to do so. Reach out at any time. We also welcome you to register for our online portal. We put a link in the chat. Great. Thank you, Stephanie. So folks can sign up. It's free to join, and there's lots of resources on our main choices website, but you can access a lot more in that portal, including a member directory, kind of a nationwide member directory. So you can browse other members and see who's involved in what, and connect with folks. So really encourage you to access resources through there. Again, please make sure to check out those MAPP resources. We've put some links in the chat. But we will also be sharing a document with what we call a resource roundup from today's event. So we'll be sharing that out via email afterwards. So you'll get all the links that way. So don't worry if you don't have a chance to grab them. I also want to mention there's going to be a little post-event survey that's going to pop up when you leave the coffee chat today. We really, really appreciate folks' feedback. It's been very helpful in informing our future events. So please take a moment, if you don't mind, to fill that out. And we look forward to sharing out the recording from today's session. So I think with that, just want to say thanks again to you, Anna, for a fantastic presentation. So exciting to have you back here with us for the third time today. It's been such a pleasure having you come on multiple times over the years to share about your great work. So really appreciate it. And thanks to all of y'all for engaging with us today.
Thank you so much for having me. Thanks, everyone.
Thanks, everyone. Take care.